Hi there, my name's Isaacs. I'm a podiatrist and I have a special interest in neurological conditions, particularly Charcot-Marie tooth, and I've been asked to produce a short video on podiatry and CMT. Although Charcot-Marie tooth disease is a neurological condition, the effects are often most visible in the musculoskeletal system. Certain areas of nerves are affected more than others, so the strength is lost in an asymmetric way. This results in the foot being distorted and can become either very high arch or paradoxically quite low arch. Often the muscles in the front of the leg are affected more profoundly, which can lead to a plantarflexed foot position or foot drop. As the condition progresses, one can also suffer with sensory neuropathy. This can present with pain, but more often presents with the lack of sensation. In other words, the body's ability to perceive pain and therefore threats is lost. It may seem like a good thing to not be able to feel pain, but it's actually very dangerous. Pain is what tells us when we are overloading an area of our foot, or our shoes are too tight, or even that we have a stone in our shoe. When this sensation is lost, we become more vulnerable to blisters, wounds, or even foot ulcers. With all of the extra pressure placed on the front of the foot, it is very common for people with CMT to suffer from callus on the ball of their foot. A certain amount of hard skin or hardening of the skin is actually protective and can be helpful. Just think of a builder with calloused hands. But when the callus becomes too thick or too hard or too dry, it can actually be a precursor to more serious problems and can cause a great deal of pain. One of the substantial challenges in managing patients with Charcot-Marie tooth is the sheer variety of presentation. There are several different types of CMT which can affect people different ways. So the management strategies will be as varied as the people who require them. So with the disclaimer that these may not apply to everybody, these are my top 5 tips on looking after your feet if you have CMT. Number 1 is to moisturize your feet. There are a large selection of foot creams available on the market. In general, the active ingredient is urea, and the concentration that you want for everyday use is 10%. If you have very thick, hard areas of callus, looking for something with 20 or 25%, usually marketed as heel balm, may be useful. Whilst callus is not necessarily a problem, dry, hard, flaky callus very much is, and regular use of a good emollient will help a great deal with this. In at number 4 is to visually check your feet every day. This is most important for people with sensory loss, as without a protective pain sensation you may not know when there is a problem. But for anybody with Charcot-Marie tooth, visually checking your feet daily will enable you to observe and act upon any problems in a timely way. A stitch in time really does save 9, and if you're able to pick up a problem when it's small, it can often be dealt with very simply, whereas if it's left until it's severe, it can be much more difficult to manage. In third place, it's important to select the right shoes. They should have plenty of room in the toe box, be nice and soft, especially under the forefoot, and offer good support around the heel and ankle. In at number 2, be very cautious with over-the-counter foot care products. Rasps and abrasives can cause damage to the skin, and corn plasters and callus peels and the like often contain very powerful acids which can cause skin breakdown and ulceration. As a general rule of thumb, if the product says it should not be used by diabetics, it should not be used by people with CMT. And my number 1 tip for people with CMT is to see a podiatrist regularly. For some people, this is a question of reducing callus and keeping nails under control, but even if not, an annual check on your feet can work wonders. Prevention is always better than cure, and we are generally the best placed people to help prevent you from suffering from foot problems, whether that's through orthotics, or debridement and actual treatment, or just advice on self-care. There is no doubt that with Charcot-Marie tooth, foot care can be a challenge. However, with the right support and the right help, it's a challenge that can be met. Thank you for listening, and I hope you enjoy the rest of the videos in this series.